HIV and AIDS? What's the difference? The first stage of the virus, HIV, stands for Human Immunodeficiency Virus. HIV attacks the body's immune system, especially its T cells, which are the cells that actually help the immune system fight off disease. Over time, when the immune system is severely damaged, this leads to the second stage of infection, AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. When the body with HIV is left untreated, the number of T cells in the body can reduce, making the body more vulnerable to infections or cancers. The body is considered to progress to AIDS when the number of your T cells fall below 200 cells per cubic millimeters of blood. If HIV is found in earlier stages of the virus, AIDS can be prevented. However, if you wait too long to get tested, this may not be the case. Another reason it is important to get tested for HIV because it is the only accurate way of knowing you have HIV. There are symptoms of HIV, but they are very commonly found in other viruses. These include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, etc. You cannot identify these specific symptoms with HIV. There is no effective cure for HIV that currently exists, but with proper treatment and medical care, HIV can be controlled. The medicine used to treat HIV is called antiretroviral therapy, or ART. The user uses ART consistently to keep the level of their HIV in their body low. This will keep them strong and healthy and reduce the likelihood that they will ever progress to AIDS. I bet the question you're all wondering is, well, how do you get it? Blood, semen, breast milk, and rectal and vaginal fluids are all ways possible to get HIV. In the United States, the most common way to get HIV is through sexual behaviors. It is more common to get HIV through anal sex than it is vaginal. And it is very rare and only in extreme cases through oral sex. If you're having any type of sexual behavior with anyone, it is important to get tested for HIV. Sharing needles or syringes with someone who has HIV is another common way to get it. HIV can live in a used needle up to 42 days, depending on temperature and other factors. It is common to get HIV through the preparation of injected drugs. It is less common for HIV to be passed from mother to child during pregnancy, birth, or breastfeeding, although this is not the case when the mother is living with HIV and not taking medicine. HIV is not spread by air, water, mosquito, saliva, tears, sweat, shaking hands, hugging, sharing toilets, drinking fountains, or other sexual activities that do not involve the exchange of body fluids. In the United States, gay and bisexual men of all races are the most severely affected by HIV. 1 million are living with HIV in the United States, and 1 in 8 living with HIV are unaware of their infection. About 1 in 4 new HIV infections are among youth ages from 13 to 24. Most of them do not know they are infected, and they're not getting treated, and they unknowingly pass the virus to others. Currently in the world, there are 36.9 million people who are currently living with HIV or AIDS. The vast majority of the people living with HIV are in low to middle income countries, particularly in sub-Saharan Africa. 2.6 million children worldwide are living with HIV. Most of these children were infected by their HIV-positive mothers during pregnancy, childbirth, or breastfeeding.